Hello, my name is Hayden Guss, and my Global Health Senior Honors Thesis title is using the Syndemic framework to evaluate cross-border tuberculosis interventions at the US-Mexico border. Tuberculosis, or TB, is an airborne respiratory illness caused by the bacterium Mycobacterium tuberculosis. TB is considered an infectious disease of poverty, and while it can necessarily be cured and treated by multiple antibiotic regimens, many people in impoverished communities worldwide still die from this disease each year. The US-Mexico border has a significantly higher incidence of TB than either the United States or Mexico. And in response, there have been many different interventions that have either been designed, studied, or implemented. But when these interventions are designed, they mainly focus on the effects of mobility, or the movement of people in either direction across the border. When conceptualizing the patient experience of TB, many of these particular interventions will mention various social determinants of health, such as stigma, but they do not necessarily target these social determinants in their interventions. My thesis takes this a step further to describe the clustering of disease and social factors using the concept of a syndemic. A syndemic can occur when more than one disease is endemic around a particular community, and when two of these diseases can affect each other and increase the progression and severity of each disease. An example would be the clustering of HIV and TB. Endemic social factors such as stigma and stress also tend to cluster with TB, and this subsequently affects TB severity and treatment outcomes. When the syndemic framework is applied to different cross-border TB interventions, it is revealed that testing and screening, treatment access, and treatment adherence interventions for TB at the US-Mexico border often do not fully consider these syndemics. And as a result, this leaves an area where interventions could be designed in an effort to further control TB infection and improve treatment outcomes at the US-Mexico border. One particular recommendation would be using intervention designs that incorporate ideas such as health education or community health education to better address these syndemic issues, especially in the clustering of stigma or stress with TB. Syndemics are not exclusive to the US-Mexico border, and therefore the overall significance is that by focusing on syndemics when designing cross-border tuberculosis interventions, health outcomes can be improved for impoverished communities neighboring border regions worldwide.